All right. Well, thank you very much, everybody, for joining this Community Health Roundtable discussion, where we have a very special guest today, Margaret Odera from Kenya. Now, I've known Margaret for a couple of years, since we first started meeting on the community health speaking circuit. As a member and co-founder of the Community Health Impact Coalition, better known as CHIC, we often say that we don't want to talk about community health workers until they're in the room to speak for themselves. We believe that's the best way that we can be companions to this movement for professionalizing community health workers. And as such, Margaret Odera has become a staple in this opportunity because she is such an incredibly eloquent and unique individual who continues to work in community health, but also serves as a beacon of light, hope, and inspiration for community health workers and people who care about community health workers and community health everywhere. So the talk today, which Margaret generously agreed to take part of, is actually a sort of follow-up, because Margaret has done podcasts in the past. And instead of having her repeat some of the stories and the things that she wanted to talk about then, we will urge you to hear those for yourself. In particular, I'm thinking of a podcast by our colleagues at CHIC called Damagi, High Impact Growth, and Amy Vaccaro did a wonderful conversation with Margaret called Championing a Movement to Pay and Professionalize Community Health Workers with Margaret Odera on high impact growth. And you can find that wherever you get your podcasts. So, Margaret, enough of an introduction on my side. Thank you for being here. Maybe you can introduce yourself for those who haven't gotten to that other podcast yet, and then we can get into the conversation.
Thank you so much, Dan. It's a privilege. I'm greatly honored to be here. And it's such an honor for giving us this platform to make our voices heard. Very important for the community health workers. My name is Margaret Odera. I am a community health worker and a mentor mother, reporting to Mathare North Health Center and living in Mathare North. So Mathare North Health Center is my neighbor. I serve my community as a community health worker and a mentor mother. As a mentor mother, I mentor HIV-positive pregnant and lactating mothers so that at 18 months, the babies will be HIV negative. As a community health worker, I do mobilizations, I do sensitizations, I do linkages, I do referrals, and I do follow-up in my community as far as health is concerned. And I also interpret the language of health to the community as simple as possible so that they will understand in the language that they can understand better.
Thank you so much, Margaret. And myself, having worked with community health workers in a variety of contexts, I know the type of work that you do firsthand. And at the group where I work, Partners in Health, we often call community health workers the backbone of our work. And the reason why is because we know that diseases start in the community, but the best healing also happens in the community. So having that direct contact with households, with the bedside, with community processes, that's incredibly powerful. And so I'd love to get a little bit into the unique position that you hold, in that you're now an internationally recognized name in community health, while also working on a very local level. Just recently, you and I shared a number of spaces at the UN General Assembly in 2024 in New York City. One of the things that the Community Health Impact Coalition has increasingly gotten into is working with community health workers who are hoping to start their own associations. And there's many examples of where associations begin and flounder, or associations begin and take off. And we wanted to check in with you. How is the association going that you're working with? What's a little bit the story of how you got to this current point? And where do you see you guys going?
Okay, we are now going to 11,000 community health promoters across 47 counties. We have covered 47 out of 47 counties. Last time I was talking to you, what, 43 out of 47. Right now, every county has representatives in the National Association. And today, I am so happy that we presented our memorandum at the Senate. It was positively received. Entering at the Senate is not easy. But for us, I think it's because we now know how to present ourselves, courtesy of CHIC training. And we presented a memorandum that was very positively received. And I'm so glad that the clerk said that memorandum is very neat and it's very organized. So as she was rubber stamping, and I was very impressed, we were very encouraged today, as I just came from there and I came straight in the house. Wow. Yes, and we are at the point of getting the letter of no objection from the Ministry of Health. I was told by the legal office to go on Tuesday and check on that letter of no objection by the government itself. And at the moment, every discussion that we make is very simple because we are doing it via WhatsApp. So if I want to visit a county that is hard to reach, that is Turkana, I will go to my WhatsApp and I will go straight to Turkana County and I will get them and I will speak to them from there. So we are so much grateful because of the WhatsApp groups. We started 5. We started 5. And the reason why I believe that we should be together as community health workers started in 2020 when I went to Prince Mahidola Award Conference. And I went there as a mentor mother. Somebody was going to speak about her life and mentoring HIV-positive mothers. And at that point, I realized that one of the topics was about the community health worker. And this community health worker was never there. No single community health worker was there because I went there as a mentor mother, not in the capacity of a general community health worker. And doctors and nurses and other cadres were there to speak about the community health workers. And this has happened. And I thought this has happened since 1988 in Kenya. And even by 2020, no community health worker was being paid. No community health worker was going through a professionalized training. So I asked myself, what are these people advocating for? Why are we not supplied? Why are supplies coming direct to the community health workers but never reaches us? It reaches doctors and nurses because they felt that they were the ones who are supposed to get those supplies. No community health worker was getting any supply. And this got in my mind. And when I came back to Kenya, I told my fellow community health workers, I told Sheringham, there was Elizabeth, there was Lois, there was Dennis, and there was me. And I told them, hey, listen, nobody recognizes you? Because somebody asked me just right there at the Prince Mahidola Award Conference. Yes, we know that community health worker creates a positive impact and they do a lot of critical work in the community. But who is this community health worker? Because we were never there even in the system. The master list was not there, so my name was not there. Even if you went to the Ministry of Health and looked for Margaret Odera, you could not find me. Because there was nothing showing that the community health workers exist even in our country. And in 2021, Dr. Madeleine Bala, together with the WHO staff and others, came up with an idea of creating a master list. And this master list, for the first time, came now to the whole country and other African countries. So that was the power of advocacy.
Right.
And when my idea was to be together as a bloc and advocate for ourselves. Because I told the community health workers that we will not be advocated for by anyone except ourselves. There's nobody who's advocating for us anyway. Because we cannot stay for 100 years not being paid, not being professionalized, not being supplied for 100 years. That means that nobody is advocating for us. So that's how I decided that we stand by ourselves. and start advocating for ourselves. Yeah.
It's incredible the story that you tell, from anonymity to advocacy, the ability to speak for yourself and to also control your own destiny. I wanted to just get your reflections a little bit about that personal experience of, at one point, working incredibly hard but somewhat anonymously, without the supports you need to do your job fully, with headwinds and people not fully recognizing all that you do, to also becoming an international speaker, flying all over the world, far beyond the neighborhoods of Nairobi where you work. What was that experience like? How have you accommodated to that new opportunity?
I'm very, very happy, and I feel so honored that this opportunity came to a community health worker. And not only me, there are now many community health workers who are coming up, and when I see them speaking in places, I feel we are getting there. And someone somewhere had to take a risk. It was not easy. It was not easy, because when I started the WhatsApp group, and it was like a representative from the government said that I'm starting a rebellious group, I'm starting a revolutionary group. Because for a long time, for all these years, community health workers were put in a certain cocoon by design so that we cannot speak. We thought of ourselves as people who are not educated, we don't have knowledge, and people were just put in that design. Until other community health workers were telling me to shut up, because they were afraid that, punishable by law or by something. And no, I was just saying, when we started 5, I told each and every 5 of them that you are going to be an admin. Bring other people, you add, everybody is able to add another community health worker and other people. So in the process, when Nairobi had 1,000 community health workers, and I decided now to communicate the real purpose of this group is for advocacy. We have to advocate for our pay, we have to advocate to be professionalized, to be trained, to be supervised, and to be supplied, because somebody has to speak. If we continue keeping quiet, the health fraternity will know that we are very comfortable when we are not supplied. We are very comfortable when we are not paid. We are very comfortable when we don't receive training. Silence means comfort. You are comfortable in whatever, but when we speak, because it is against the laws of nature to be in a place that is not acceptable and you keep quiet. It's a bad example to our generations to come. So I told them we have to speak out. And I told them, I'm ready, because I have nothing to lose. I am not paid anyway. And I will continue to mentor my community, because somebody told me that I'm going to be removed from the community health worker. And I told them, once a mentor mother, always a mentor mother. Once a community health worker, always a community health worker. They will remove me from going to the hospital to report, but they will not remove me from telling mothers in my community the right thing to do, the health, the health interpretations from the hospital.
Wow.
And so my job was at risk, my work was at risk, but I decided, okay, it has now come to the worst, it has already happened, and the water is already spilled. And there's nothing I'm going to do but just to continue, because I was in the middle of a hard rock and the wall. So I had to not turn back. And we continued like that. And I was just writing on the walls, pay CHWs, professionalize CHWs, because we go to the community, we were going to the community even without a sanitizer during the times of COVID. No sanitizer, and the only thing we are having is a pen and a paper. I mean, it was not right. I could even photo myself writing with that pen and a paper, talking to a client, and post it in LinkedIn so that people will see what is happening on the ground. And we have come from very far, and many community health workers left the groups. Many community health workers, because they were so much afraid. It was so messy. The tension was very high. And that moment is the time I appreciate Dr. Madeleine Ballard because of that. She was in that WhatsApp group and she decided to come in person because it was hot. Decided to come and see what is happening in Kenya. So she came in person and we met as community health workers in Mathare North. And she spoke with us. She encouraged us. She told us, we are together and the world is watching. And sometimes we needed friends from outside so that our own will see that there is somebody else who is watching apart from ourselves. We are not in the dark alone. And because I met Dr. Madeleine Ballard through LinkedIn, so we decided to, some community health workers now also got encouraged to speak hiding. They didn't want to come out until I said, when I received the Heroine of Health 2022 Heroine of Health. And when I went there, that's the time now, even the Ministry of Health recognized that the community health worker now has been recognized in the whole world, and they have no choice but also to recognize us.
Wow. And
in that moment, I said, many other times, women have been put into cocoon because 70% of the community health workers are women. And I think that is why the governments, especially in Africa, is taking the advantage. And somebody was telling me that, we cannot do this because you're not educated, you're not learned, you're not trained. And women in Kenya and in Africa were less privileged to go to school, not because of our fault, but because it was by design, by the government and culture was going hand to hand. So there was a time even my own father, when I was 16, he told me right now, I was very happy bringing a report form that I am the best. I was the first in class. And then my father was telling me, now this is enough. You're bright enough. You're a lady now. This is enough for you. I'm not going to pay school fees for you. It stops here because you have enough knowledge. God rest his soul in eternal peace. Wow. I love my father.
Yeah.
And I really cried. I remember I cried a lot during that time. And somehow I was able to complete my O-level. Yes. I struggled. I started fighting for myself when I was very young. And he passed away before he saw my results. And that's unfortunate. And during that time, when the government was saying about we are not educated, it reminded me of what was happening during that time. Right now, we are aging gracefully. But the bigger part of the community health workers had the same experience. Some of them got married at 16, 15. That is the time that was the ripest time in Africa. So at 16, 15, people just see that you are ripe enough to get married, and it is very unfortunate. And that cadre most of them never finished. But right now, when we started creating a positive impact, I told the government that the best thing you can do to us, the favor you can do to yourself as a government and the health fraternity, is train us. If somebody never finished Form 4, take that person back to school, train them, because right now we have a part-time training. That person can go to school and get more trainings. That is the way you can sharpen the basement of the health structure, which is the community health. Because you cannot have a weak community health that is not trained, is not paid, and we expect to have a strong structure. So with that, some of the community health workers have gone to school. They have advanced themselves in career progression. Most of them have finished their Form 4. Right now was an issue of career progression. And when the Ministry of Health was talking about the Kenya Medical Training College, about KMTC, and KMTC are training CHAs, the supervisors, the community health assistants. There is no curriculum for the community health workers. And I told them, no, I think you're not listening. I'm not talking about being trained as a community with the community health assistant curriculum. I'm talking about a curriculum that is for the community health worker. That curriculum that entails mobilization, sensitization, referrals, linkages, follow-up, one-on-one, mentorship. That is what I'm talking about. It is not there. It is not there. And I believe that LinkedIn has also played a very important role. Because if you don't listen to me when I'm speaking to you, I go to social media and I will post. It really itches me. I can't stay without something that is in my mind. So with that, we continued like that until we are reaching where we have reached. Right now, the government is thinking of even training the community health workers who never reached where they were supposed to reach. I've struggled myself. Right now, I have the latest training that I have was from the University of Washington, Policy and Advocacy. I'm getting my certificate on 17th of this month. Yeah, it has been shipped right now. I'm going to take it on 17th. And other community health workers are also doing career progression.
Wow.
And that was settled. Now, we are going step by step. We came from far. With pay, when there was this bill of 2022, we decided now to sit down and write a memorandum. The doctors and the nurses were so much against that memorandum that we wrote, and they were so much against that bill. They wanted that bill to be scrapped off. And that's that one thing I will appreciate the President, William Ruto, for a very long time is because he is the first president to be bold enough to recognize that the community health workers should be paid. He signed the bill, the 2022 bill from the parliament, and it signed it to be a law that the community health workers should be recognized and should be paid a stipend. I know he has started small by paying us a stipend, but at the back of his mind, I know he's thinking about a salaried community health worker. And by that, our names were changed from the community health volunteers to community health promoters in the year 2022 October. 2023 October. Then we were given supplies. We were given a blood pressure machine. We were given a diabetic machine. We were given work tapes. We were given smartphones. We were given an app that is called Electronic Health Information System. Now we report digitally. So we have really come from far. We are in the master list. Right now, if you go to the master list of Kenya, you just look for my name, you'll find Margaret Odera there. And 5 years ago, nothing like that was there. So that is the power of advocacy. Because I told them that the community health worker who saved my life, because I was running away from one house to another. And one day I was tired of this community health worker following me around in 2008. And I told her to get out of my house. I don't want to see her because I had turned my back to everyone because of my status. And even my family members came to know my status after everybody else had known because I disconnected completely myself from anybody of my family. And this community health worker became the only friend I had. And she was not so much learned, but she told me, Margaret, what if God is just delaying your cure? What if you have a lot of things to deal with? Your mental health is bad because I was always alone. And when I was telling the world, when you look at when I was receiving an award last year in 2024 on Co-Group, Community Health Champion, I spoke about this community health worker. She was not very much learned, but she saved my life. I accepted to take ARVs because of this one person. And all my children are now negative because of this one person. So community health workers save lives. And after being given all these commodities, the doctors were the greatest hindrance and the nurses, they were the greatest hindrance, saying that community health workers are being paid right now and nurses are out there, they're looking for jobs and they're not. 20,000 nurses have not been employed since 10 years ago. And I was told to sit in the middle of the Council of Governors, and it was a lot of, you are so much discouraged that people are talking ill of you. But when I stood up, I was told to speak about this. And luckily enough, I was sitting with the personal advisor to the president, and he told me, don't be afraid, you speak out. And I asked these nurses, if you're not employed, you have 10 years without being employed. Who is that nurse who stays in Mathare? And somebody raises her hand. And I asked her, with your papers, have you ever come to me and told me, hey, Margaret, I have just graduated. Let's go to households and let me start doing my practices there to have experience. So with these 10 years, I have not seen any nurse coming to the household. Which experience are you going to take to the hospitals? You'll need another refresher course. Yeah, so it was a heavy debate. And I also told them, you are too qualified to start scrambling for space with community health workers. I mean, are you going to go to doors and start mobilizing and start saying polio the way we are doing? No, you are too. You are higher than that. And people laughed, but at least they took the point home.
Yeah. So
I had to be bold enough, and other community health workers, I'm so grateful that they are coming up. So dealing with this going international, I mean, it makes me stronger.
Yeah.
And I love it. At first, I was very nervous. But when I get to a place where the health fraternity is accepting me, acknowledging me, giving me that honor, it makes me speak out. It makes me speak out, and it gives me the courage to appreciate the fact that the community health workers are being recognized by the president himself, even right now. Wow. So even those awards, they are a plus to the community health workers.
Wow.
It tells me that community health workers can reach at the top, and because they deliver from the grassroots, where pandemics and outbreaks start, they should be included in each and every cadre, each and every meeting, and each and every decision-making table. It is important to include somebody who is in the middle of that pandemic and outbreaks, when they start and when they stop. Yeah, so I feel so much encouraged, and I feel so happy when I see a community health worker, like last time, Millicent, a community health worker who was introducing Dr. Madeleine Ballard in that prize-giving day. I think it was last month or some weeks ago. I was so happy. I stood when I was looking at that video. I literally stood up because it was so nice. She was speaking out the reality on the ground, and I think that is the way to go.
Yeah.
Yeah.
I think that was the Schwab Award, where it was the video introduction. Yeah. Sheik has.
It was very short. It was short and very sweet, very nice. Yeah.
Sheik has won some awards for its work, and you also have won awards. You spoke about the Community Health Champion from the core group, the Heroine of Health Award. You also, beyond awards, you're awarded with space to speak and to growing with the University of Washington certificate, being able to speak and represent community health workers with the government. And what I heard in the incredible stories that you're telling is that there is this tension between participation and rebellion. It's called rebellion, but maybe it's just strong participation going against the status quo. That's what makes you a force of nature. And I think why these awards are well-founded. You are tireless, as your community health worker, mentor mother was with you. That is actually how we can make the world a better place, is that when we trust our vision and move forward. I myself, when was able to sit with you in a conference in Liberia, I knew that my most important job was to say one or two things and then pass the mic. But also pass the mic, I'm a physician. I knew that passing of the mic is also a symbolic act. It's saying, community health workers, as you described, are in the households. They go door to door. That is unique work that only they can do because of their unique position and because of the time that they have. I myself would love to do that. I'm a lot of times stuck in a clinic or a hospital or a boardroom, and that's why these partnerships are so important. And you spoke about the importance of not only partnerships in communities between community health workers and with the government, but also internationally. We live in a globalized world, and you guys getting courage from the CEO of SHE, the Community Health Impact Coalition, Madeline Ballard, coming and talking to you and saying, the world is watching, have courage. That is an example, I think, of the best of a globalized world. Is that we're human beings connecting with human beings across steep gradients of national borders, of other axes of difference, and saying, ultimately, we can work together, we can make the world a better place together. So I'm very inspired by your stories. And I wonder, what's your reflections on, after these political commitments are made, right now it's a stipend, and we're moving towards salary. There are turf wars with nurses and doctors, which, appropriately they're concerned about their pay. We often say community health workers will win when the pie grows, not just when they get a bigger slice of a small pie. So the pie growing, commitments to health, how do you think that's going to play out in the Kenya context? How do you hold some of these commitments accountable?
Yeah. Okay. Speaking about this, there was a place where the doctors were saying, "Let's do an example." So they went to a place. Ahada, these people who Maasais who take care of cattle. Some of them are community health workers, so they decided to go there and say that they wanted to have reasons why community health workers should not be paid. They should not be professionalized. So when they went there, and they went and identified a Maasai that they will know that maybe he will not be able to do what is right. So he was given a blood pressure machine, and he was also given the smartphone. When he was taking the blood pressure, it was perfect. It was perfectly done. When it came to now putting patients on the ECHIS system, he took the phone and he typed very well. It was very well done. And that Maasai told the doctors one thing, that writing is more difficult than this. Right? This ECHIS is easier than writing. So instead of them thinking that maybe electronics came to make the life of a community health worker harder because she's not learned, it even made it easier. So instead of writing, you just tap 1, 2, and the message is gone. The message is done. So this little training, it shows an example that this little training that this person has gotten can be advanced to another career progression. Because if this person is removed and maybe a very educated person who speaks with the big vocabularies of health is brought to this Maasai woman who has 10 children and is continuing to give back, and you're telling them about family planning, you're using the Depo Provera, the hard language, that lady cannot even understand what you're saying. And she might even resist you. They might resist you and, say that we don't need you because they will not. Anyone who will not understand you, if you don't understand me, if you don't understand my language, you don't understand my nutrition, don't understand anything about me, you'll resist me, you'll just not waste time with me. So as much as they think that community health workers are not important, they are the reliable source in the community. And they know the language of the community, which they can translate if trained properly. They can translate in a simpler language to the community. Now, this pie is big enough for all of us. It is big enough for all of us. And community health workers are not asking for the salary of a doctor. They are asking for a wage of a community health worker, for a standard of a community health worker. Like right now, the president started small. We are given a very small stipend, $30. But the community health workers are very happy with it. And they know at least we are starting somewhere. There's a step higher. And right now, we are owned by the government. This money does not come from funders. It is the government itself that owns us, which means that they can do more if the right budget is allocated. Because sometimes there's some money that is allocated for the community health workers, but the governors think that because this is not important, they allocate that money for something else. And this is not fair. That is what is called inequity in distribution of funds. Because if you have been given this, like that bag, the backpack that was given, and it came directly to us, it brought a lot of problem. And that is how we came to realize that even if there is something that is allocated for the community health workers, we don't get it because doctors never think that we are supposed to get this. I believe that this pie doesn't have to grow bigger for the community health worker to have a share. This pie is big enough for all of us. And the way it is divided is the problem. It is divided as 90% doctors, 70% doctors, 20% nurses, 10% other cadres, and then we get 0.001%. It is just the inequity. It is not an issue of the pie has to be bigger. We cannot wait for. How about if it grows bigger by 100 years to come? We can't wait for that. The best thing they can do is to share this pie and give a community health worker a fair share. There is a very big gap between the doctors who are up there and the nurses who are up there, and even the community health assistant. Right now, the community health assistant who is lowest paid is paid 40,000 shillings, and we are getting 3,000. That is a very huge gap, which is very unacceptable. Because I'm a community health worker who submits reports to this community health assistant who waits for the reports at the end of the month in the hospital. I give that report that informs policy decision. So the gap between a community health assistant, the direct supervisor, who is my direct supervisor, and the community health promoter is a very big gap. From 40,000 to 3,000, and that is Nairobi. Nairobi is the highest paid with 3,500 shillings per month. That is $30 per month. I am the highest paid. Somebody in Nakuru will get 2,500 per month. That's around $19 to $20. And yet the person who is supervising me is getting 40,000. I think that gap should be not that wide. Should not be that wide. It is very unfortunate that we are below 10,000 and the person is getting 40,000 is supervising us. At least that gap should narrow. It should be narrower. Yeah. With the same resources, if it is divided when there is equity, we are going to get something that is better for us than these 3,500 shillings. Yeah. So community health workers, we don't want for the pie to grow. We just want the division of this small pie to be divided fairly.
Yeah.
And everybody's going to be happy. Yeah.
That touches upon what is increasingly a part of community health advocacy, which is messy internal politics. How do you divide up existing resources? And then if we do increase the pie, who contributes? It reminds me of, I live in the United States. I work in a variety of countries, but I'm mostly based in the United States. And right now we're going through a particularly unique moment with our internal politics. in which there is the goal to rewrite much of how resources are distributed and utilized, especially government resources. A big part of this is international aid, especially U.S. aid, and it brings into question the role that the United States has in partnership to these questions that you're bringing up. We're speaking today on February 14th. Happy Valentine's Day 2025. And
thank you. Happy Valentine's to you.
Thank you. And, you know, we know that there is currently a freeze on aid spending. That has created a very real experience on the ground. The community health workers are the closest to the stories, the closest to the patients. There's an old saying, those who are closest to the pain should be closest to the power. I'd love to hear a little bit from you about what you're seeing over these last few weeks in response to this redefining of how our international collaborations and commitments should continue.
Yeah, it's a traumatizing situation. It's traumatizing. Yesterday, when I was in the hospital, trying to contribute in the service at the comprehensive care clinic, and the clients were coming. Some of them, they have appointment dates of March. But they are coming around 20, 30 people who have no appointment dates, only to maybe frame up that they will be traveling, so they need those drugs, extra drugs to go because they will not be around during that time. And because I have been there, I know that person is just panicking because they don't know whether that drug will be available when that date reaches. And I have never seen such a big number coming unscheduled appointment. Just because that is panic. People are panicking because they don't know if that drug will be there tomorrow. Yeah. And that fear is very real. I was also about to do the same. My clinic is on 10th of March. And I thought, hey, how about if I just take some extra drugs and go home with them? And I decided, okay, let me relax. Let me not do this because it's not right. Let me just relax myself and just speak to myself. I called myself to a meeting and I said, let me just calm down and wait things, hoping that by 10th of March, the drugs will still be there. Yeah, because I believe that if we take all those drugs, if people are going to be taking the drugs, even the person who is going to come next week maybe will not get the ARVs. So that fear is very palpable. It is very real. I remember that there is one client who is also a community health worker telling me, Margaret, I am cervical cancer positive. I am HIV positive. I will not wait for me to go back to the 20 years the way I was. That stigma, because the stigma will come back. That stigma, that kind of, fear. And going back to be bedridden and begging for food, she told me she's not going to wait for that. It's better she ends it all before that time. I'm not going back there. I can't see that. So she told me, Margaret, I better end it all because I can't imagine myself going back to that. And I told her it cannot reach to that extent. Just believe. Let's pray that it will not reach in that extent. And remember, you have kids, because even for me, one time, I thought about them, the kids. And I thought about how about if it happens like that? What will happen 10 years from now? Am I even going to live to see these children reach university and maybe have their own families? I was just thinking by myself. And when I went to the hospital that Monday, that I saw there was no worker there, we have a relief that the President of America has decided to continue giving the ARVs, but unfortunately the workers are not there. There is no USAID workers who are giving out these drugs, who are doing, even right now as I speak to you, there is nobody who is doing testing, HIV testing. Nobody is doing testing. So from Monday, today is Friday, no single person has been tested of HIV. And that is very sad. Because a surge starts like a game, just like that, slowly by slowly. And this one day, or just removing one seam from a stitch can cause the whole thing to be destroyed, because we don't know what is happening right now. These mothers who are missing drugs and their babies have missed prophylaxis, there is a very high chance that they will infect their babies. And if they do, what kind of HIV virus will come? It will be a mutant virus, because this baby is used to prophylaxis. Now, if a small opening comes and this baby gets infected, we are going to get another strain of HIV, which is more difficult to treat, because the blood system has already known ARVs. The DNA already knows ARVs. So it will be more difficult for this virus that enters in the DNA of the human to respond to the ARVs that are right now. And the world will be forced to get a higher dose of ARVs, or a stronger dose of ARVs. And it will be more expensive. And it can be messy. The same to TB. Right now, there is no X-ray taking place because my colleagues are not there. So you can imagine there is a TB, there is a strain of TB that cannot be detected by specimen, but can be detected through X-ray. And if this X-ray is not there are people who are going to go and they're not going to be tested. Right. And if they're not going to be tested, if the TB has not been detected through specimen, and the specimen gives a negative test, and this person has the TB that has been hidden, that is only X-ray that can give the test results, it means that this person will continue spreading TB in my community. And a pandemic starts like an outbreak, just a simple, I don't know how to say it. And I read somewhere that diseases do not have passports. They don't apply for visas to come to America. From Kenya to America, they don't need passports. They will just come. Yeah. So I said it just took 2 people to be tested positive of COVID, and within 3 months it was all over. So we don't know what's going to happen, not only in Kenya, because this is the whole of Africa and other countries. So we don't know what might happen. During this short time, a surge of a disease it is very possible that a disease will just surge, and a pandemic will be realized from this. So it is very expensive. And when I think of that, when I see people in my community, I see people at this thing. There is a very uncomfortable quiet. Even when the clients sit down at the benches waiting, you can feel it when you just walk. You can just see there is that kind of unspoken fear in the atmosphere. So it has really the fear is very tangible. Very tangible. At that time, even the Minister of Health was speaking and told people that we have everything is in control, but it is not in control, because right now we don't have workers in the facility. So nothing is in control, because if there is no X-ray machine, if there is nobody who is doing testing and testing of HIV, so what is in control?
Mm.
And I know out of her heart, she was saying that to calm the nerves of people, to make people relax as they are looking for ways. So they might be looking for ways for a month, or they might wait for 3 months before they get solution. So during these 3 months, what will happen?
Right.
During these 3 months that people are not being tested, that TB is not being tested, what will happen? Yeah. So yes, it is uncertainty. It's a time of uncertainty, both the governments and the community health workers themselves.
Yeah.
And the doctors. Now, the importance of community health workers in this is because the doctors' union are not talking about this. But every time you want to know what is happening to the ground, a community health worker will speak out. The nurses might speak out, but I don't know why they don't. You know. So it is very important for every cadre to come out and advocate for this, because it is very critical.
Yeah.
This is critical. One small mistake in a day can change a lifetime of a globe, of the whole world. If Kenya is not safe from MDR TB, because even right now, I have never had TB myself in my life. But if multi-drug resistant TB is right now surging in Mathare, you are not safe even when you are in the United States.
Right.
Yeah. One thing we have to realize is that bacteria and viruses, they don't need passports. They just travel. Yeah. So as this is happening, let us just remember that nobody is safe. And after every war, after every countries that are fighting, after each and every war, there comes outbreaks. Not only in Africa, but even in other countries. So after this war that DRC is going through, the health fraternities should be prepared for an possible outbreak.
Yeah.
Yes, for an possible outbreak. And if there is no funding to do prevention, to do promotion and prevention right now, then whether America likes it or not, you are going to contribute in a more expensive funding in future.
Yeah.
Because I know America has a human heart. You'll be forced to do it. You'll just do it because you are human. You have a big heart. That compassion is God-given. It is your nature. It's something that is in you. So you'll be very uncomfortable. I know America, even right now, as these funds are being frozen, they're very uncomfortable. They're not comfortable with it.
Yeah.
That's why you see discomfort everywhere. Even in the United States themselves, people are not comfortable with that because it's not your nature. It is not you. It's not America. It's not your nature. Yeah? But I believe that things are going to be better, yeah, as days go by. Yeah.
There is that incredible optimism in the face of fear that I think brings me so much inspiration. To think about women infecting their babies with HIV today.
It will surely happen. It will.
If
it continues like that.
That is the greatest injustice for that child, and it's completely treatable. It's completely preventable. It's something that really should be gone from the earth, let alone the outbreaks that you're describing, the mutations. Right now, there's a Ebola outbreak in East Africa, and these things are getting more and more powerful. They're driven by climate change. They're driven by political instability and wars. I completely agree with you. And a lot of people, I think, start to feel paralyzed in the face of this fear. In fact, some have spoken about how fear can actually be a political tool. You set up the threat of losing your livelihood, of losing your status, your position, getting on a blacklist. And so that fear does the work of what would be actually much harder. it would be much harder for courts to uphold freezes in funding and for new spending bills to be passed across many, many constituencies in the United States and beyond. But the fear of being on the wrong side of this tidal wave of
Yes.
activity makes people quit, makes people shut things down, websites, jobs, projects, research, etc., clinics perhaps. And yet there is an antidote to fear, and I see that in a lot of your work. You faced some incredibly difficult, scary moments, both your own health, your family, in your country, in meetings. And yet, in the face of this, you continue to describe this antidote to fear. As we close up, could you give us a little bit of advice on how you find that antidote to fear?
I think it's resilience. When I was born, my mother died when I was 8 months old. So I think it is a natural resilience that came from when I was very young. And, even when my father, my late dad, spoke about not taking me back to school, deep within me, I had that urge, and I told myself that I'll finish school, whether he pays or not. So I think people should be resilient, even in fighting off diseases. Somebody has cancer, and when that person knows that he has cancer himself, he starts dying that moment, slowly by slowly, before even he reaches the actual death. So I believe that people should be positive. Even when there is a blackout, there is blackness. Like the time I started the National Association, the CHW Champions Network, there was darkness in front of the community health workers. But I believed that something that disturbs me in my heart, I will spill it out. And I also think that what we were told during the Mothers to Mothers program training, that when you see something is really stressing you out, you are going through depression, write that thing down and make sure that somebody else has had it. Look for a relevant person and speak about this. Not everybody, but somebody who is relevant, who can listen to you. And I did not see any relevant person when I started the Community Health Workers Champions Network in Kenya. So I saw relevance in WHO because I knew WHO, LinkedIn is there, in LinkedIn, WHO is there, United Nations is there, many cadres, UNICEF, Save the Children, and somebody will listen. So I was just posting there. And when this time it shook me up. Actually, I was stressed out. And one day when the day came, the children, my sons had gone to school, their dad had gone to work, and I was alone in the house, and it was very quiet. That time, that thought was really disturbing me. I decided to take a book, a diary, and write, and I decided to write how I'm feeling. And the only word that I could explain how I'm feeling was goosebumps. That was the only word that I could say how I'm feeling. I have goosebumps. That's all. It was a fear that I could not even explain to anyone. And during that time, I remember that the Mothers to Mothers program told us that we should speak out wherever we are stressed out. And I thought I don't know even the address of this president of America now. Where will I start? I don't even know his address. So I decided to look at for somebody who is the closest. Anybody, anyone who works even with the government, anybody close, if it is his sons or maybe friends, anybody who I can tag who is close to the president. So when I went to LinkedIn, I started searching Donald Trump. I didn't find it in LinkedIn, but I found Donald Trump Jr. And I said, I have nothing to lose. Whether they respond positively or negatively, I will have nothing to lose because the freezing is already there. It's not that they are threatening to freeze. It is already here. So what will I lose again? Nothing. So let me try and just talk to Junior. So that's the time I wrote. The very thoughts of PEPFAR getting off funding, the very thought that PEPFAR, that America is leaving WHO, the very thought of malaria and HIV surging in Kenya just gives me goosebumps. That's what I was feeling. I was feeling very cold that time. And I said, saving lives does not make you poorer. It doesn't make anybody poorer. So I tagged Junior there, and I posted. When I saw the first like, and I saw the second like, and I saw the third like, relief started coming out of my chest because I believe that someone is carrying that burden with me. So someone is. I am sharing what my burden is, and somebody is feeling the stress. So I'm spreading the stress to other people. And when I saw 10 likes, I got so much relieved. BBC and Reuters called me, and it was around 2 hours after I posted. Reuters called me, BBC called me, and the person in the BBC asked me why I said that saving lives does not make you poorer. Yeah, and I said that it is value for your money. I mean, your money has been used in value for money does not go to waste. It doesn't. And making me stand up and fend for myself does not make you poorer. It is not a loss. It is a gain. It is a gain because if I am giving my taxes to Kenya, it is also a gain wherever you are, whatever you did. And it's also a blessing. It is a blessing because heavens are watching. There is a way that heavens just pays back. Yeah? And I told them that America, many are looking up to you as a superpower country and as a lead country. So save lives, because that's a good example of a superpower. That's why you are a superpower there. It is an obligation for you. You are not becoming a lead country just like that. Everything comes with responsibility. You might think that you're not responsible for other countries, but it will affect you directly. It will. If we thought that we are not responsible for maybe Marburg, right now, many people could have had Marburg. If we thought that we are not responsible for COVID, everybody shut down your borders now, no coming here. It will just destroy us as the whole world. So we are responsible for each other. And that, I know, I believed, and I told BBC that I believe, yes, America has got its own challenges, financial challenges, but you have your own challenges. Yes, the president has to maybe redo some things and all that, but not not for an expense of making an innocent child getting HIV positive. It is not on an expense of me going back to be bedridden. This is not a war. It's not a war. I mean, we are not repenting on anything. This is life. Life, and life, if we are talking about preserving nature, saving lives and providing this medical assistance is preserving nature. It is. nature is not all about trees and air we breathe. It's also about human life. Yeah. It's preserving nature itself. And nature is very vengeful. Whatever you give, if we plant trees, we are going to get fresh air and pollutions are going to stop. It is the same thing as with a human being. If human nature is not going to be preserved, it's going to destroy all of us. It normally comes back. So what I can say, saving lives is preserving nature. It is. And also, we are all obligated by one another, with one another. And when you are put as a lead country and a superpower, it comes with responsibility. That is one thing heavens or God expects of somebody who has a responsibility. If I was not earning, but right now I have an earning, I have a responsibility of educating my children. I have a responsibility of making sure that my children are safe, healthy. I have a responsibility of making sure that they have good shelter. And if there is a country that has a superpower, it has been given an obligation and a responsibility as a parent country. And it does not go to you can't go down because you're saving lives, because you're saving nature itself. Yeah, that's all I can say.
And you've said a lot, and all of it has come straight to heart. I take great solace in your advice that we will be stronger together in community, and that will build us our resilience. And at the same time, we step up to the responsibilities that we've committed to and that we continue to be responsible for as community health workers, as doctors, nurses, as superpowers, and the like. An international community. Margaret, wonderful opportunity to speak with you. Thank you so much for your time.
Thank you.